AAPL, has officially reported its earnings for fiscal Q3 2021, covering the months of April, May, and June. In a reversal of its earlier position, the agency is now recommending that some fully vaccinated people wear masks indoors if they live in areas with significant or high spread. Currently, much of the country falls into that category, with the exception of the Northeast and parts of upper Midwest. The CDC provides this link if you want to see the area of spread in the county where you live. This was not a decision that was taken lightly, said Rochelle Walensky, the CDC's director, acknowledging that people are tired and frustrated. But Walensky pointed to new data showing that, while vaccinated people still account for a small amount of risk, in rare cases they can get infected and spread the virus to others. The Delta variant is showing every day its willingness to loosen us, Walensky said. When we examine the rare breakthrough infections and we look at the amount of virus in those people, it is pretty similar to the amount of virus in unvaccinated people, she said. And it's possible that because of this higher viral load, people with breakthrough cases of Delta may be able to spread it. Unlike the Alpha variant that we had back in May, where we didn't believe that, if you were vaccinated, you could transmit further, this is different now with the Delta variant, she explained. The CDC move comes as the highly transmissible Delta variant fuels the surge in cases around the country, and multiple cities have reinstated indoor mask mandates, including in Los Angeles County and St. Louis. For weeks, many public health experts had been nudging the agency to change its policy, arguing that fully vaccinated people should wear masks in indoor settings, especially in areas where transmission of virus is high. We have places that are now reporting over 300 cases per 100,000, so an extraordinary amount of viral transmission, Walensky said. And she again urged people who have not been vaccinated to get their shots. The highest spread of cases and severe outcomes is happening in places with low vaccination rates and among unvaccinated people, she said. And the associated illness, suffering and death could have been avoided. In addition, the agency recommended that all teachers, staff and students of K-12 schools wear masks, even if they are vaccinated. As the Delta variant spreads, particularly in areas where vaccination rates are low, kids remain unprotected against the virus. The vaccines are not authorized for children under 12, and many teenagers have yet to get vaccinated. The nation's leading group of pediatricians also recommends mandatory masking in schools for all students over 2 years old, staff and teachers regardless of vaccination status. In May, the agency signaled it was safe for fully vaccinated people to stop masking in most settings. At that time, cases were dropping significantly, and the vaccination campaign was in full swing. Nearly 2 million shots were administered on the day the policy was announced. You can do things you stopped doing because of the pandemic, Walensky said at the time. The hope is that dropping the mask mandate would encourage more people to get vaccinated. Back in April, when the outdoor mask mandate was lifted, President Biden said that for those who haven't been vaccinated or feel they don't need to be, this is another great reason to go get vaccinated now. But 3 months later, about 30% of adults in the U.S. haven't been vaccinated. And polls suggest that up to 80% of unvaccinated adults are unlikely to change their minds. The decision to lift the mask mandate in the spring wasn't well thought out, said Dr. Zeke Emanuel, a health policy researcher at the University of Pennsylvania, and the agency has been delaying taking action as the Delta variant spreads.